Hi, welcome to the Make It Stop update. I'm Dr. Winnie King. You know, pain is universal. Almost half of all Americans seek treatment for pain each year. 7 million from newly diagnosed back pain alone. What can be done to help the disabling effects of chronic pain? Well, we have two people here who say today, don't give up. They have the tools that can help you ease your pain. Please welcome orthopedic surgeon Dr. Rob Palumbo and pain management specialist Dr. Felix Linetsky, who has some very interesting and new ideas on treating pain. And welcome all of you here to the show. And in addition, we want to mention that we have some patients who have had some very interesting experiences with pain too. Pain is something that everybody can relate to. We've all had pain at some point in our lives, but when it becomes chronic pain, where it starts to really affect our lives, that's when we start looking for help. Dr. Palumbo, as an orthopedic surgeon, I know that's usually what brings people into your office is pain. Back pain, pain of their wrist or their elbow. What are some of the new things that are out there now in your conventional world of orthopedic surgery to treat pain?
Well, I think we always say there's nothing really new. Some of the things that we're opening our eyes to for the more chronic pains, I think certain modalities such as acupuncture are becoming much more...
That's becoming more mainstream now. There was a time when acupuncture was kind of off to the side. Nobody did acupuncture, or they didn't admit to it if they did.
That's right. Now you have physiatrists and anesthesiologists taking long courses so they can become proficient in it.
And you have with you a lady who is very lovely and smiling and happy and pain-free, but apparently at one point not pain-free. Terry Cole, you had an injury that caused you to have a lot of pain. Tell us about it.
I had tendonitis in my elbow, and it got to where it was debilitating. The pain got intense, and it got to the point where I was dropping things. I was losing my grip.
Yeah. And so what happened? So of course, you know, shake it off, you know, maybe take some Tylenol or some Advil or something to try and make it go away.
We tried that.
Yeah.
Eventually I got to see Dr. Palumbo, and we tried some physical therapy, strengthening of the arm, and then some cortisone shots. Yeah. And when it got to where I was dropping things and the pain was becoming very bad, then we went with surgery.
And what type of surgery did you do?
Well, actually what we did was a release of the tendon that was causing the problem. What tennis elbow is a degenerative change within the tendon around the elbow. And we tried all the modalities such as physical therapy and certain cortisone treatments in physical therapy, and then direct shots, exercises, use of a tennis elbow brace. Nothing seemed to work. So after we tried everything else, we went in and did the surgery.
And the surgery worked?
Yes, terrific.
And so you're pain-free, everything is wonderful?
Yes.
And does she have now a risk for having problems with her elbow later in life? You know how they say, oh, I'm going to have arthritis, I'll be able to tell when it's going to rain because I'll have pain in the joint?
Normally not. Normally this treatment is very successful and it doesn't come back normally.
Well, let's certainly hope that it stays gone, because I know you don't want that. You're very active, and you're also involved in aerobics too, and so you need your arms to be in good shape. But you know, it doesn't always work out that way for people. Sometimes you do the very best you can, and still there's chronic pain. And that takes me to our next guest, Dr. Felix Linetsky, who is a pain management specialist and someone who has a very interesting approach to chronic pain. It has to do with prolotherapy, and I'm sure this is a term that most people have never heard before. I'd never heard of prolotherapy. What does that mean? But it's a very interesting concept, and it was there's a book out called Prolo Your Pain Away, and it's written by Dr. Ross Hauser. And this is a very interesting approach to curing pain, and it's something that some folks might find to be rather odd. So I'm not going to give any more away. I'm going to let you explain to us, Dr. Linetsky, what prolotherapy is.
Prolotherapy is an injection treatment that stimulates the body to repair the painful area or painful problems within the connective tissue, such as ligaments or tendons.
But this is not cortisone injections like what Dr. Palumbo was doing.
The injections indeed are not cortisone. The injection usually a mild solution of sugar water or dextrose mixed with local anesthetic. When deposited next to the bone and fibroosseous junction, junction of the muscle or tendon to the bone or ligament to the bone, it creates some irritation which stimulates the natural repair of the body, repair process, and the repair process called proliferation. and thus stimulates the growth of the connective tissue or ligaments and tendon and abolishes the pain.
Wow, I mean, that is really, really quite different. I mean, I understand what you're saying, though, because the body does have a wonderful way of healing itself, and sometimes it just needs some stimulation in order to do it. And that's what you're saying that prolotherapy does with the sugar?
Exactly what we are doing, and there was a doctor in America, Louis Wanderschat, who called it the American version of acupuncture.
Yeah, well, you know, we have on the screen here someone who's getting this procedure done now, and they're not jumping, but that looks like it hurts. Now, is that painful?
Indeed, this is slightly uncomfortable, and what you see on the screen is the way Dr. Hauser is addressing the problems for the headaches and the problems with the neck pain.
Okay, but see, doctors always say things are uncomfortable. Now, I mean, when we say uncomfortable, I mean, it is uncomfortable to do it, but does it hurt? I mean, does this really hurt? I mean, that looks like it hurts.
King, it doesn't hurt any more than the injection by a dentist.
Okay.
It's rather unpleasant.
It's unpleasant.
But again, it depends on our perception of pain.
Exactly right. And everybody's a little bit different.
Everybody is a bit different.
Okay.
And if the patient is in chronic pain and really at the end of the rope, they don't mind a little bit of injection
to get over
the painful area, because right away, right at the insertion of the needle and insertion of the local anesthetic, they feel the relief of a chronic pain.
And we've got a gentleman sitting right next to you who knows exactly what that's all about. Greg Hill, you are a professional tennis player, and you sustained some injuries that led you to Dr. Hauser, the doctor who actually wrote the book, Prolo Your Pain Away. Right. Tell us about that. What was going on with you that caused you to have an injury?
I had surgery on my wrist, which they said I'd be back within 6 to 8 weeks.
Well, what was wrong with your wrist?
I had a ligament tear and a cyst.
Okay.
And after the surgery, I was worse off than before. A year later, I was still searching means of curing my pain. I traveled all around the world looking for means. I saw roughly 15 orthopedic surgeons.
Really?
And
so what did they do? What kinds of therapy?
Cortisone injections. They wanted to do surgery on me again. Anti-inflammatory medicine, and none of this was working. It was making my injury, my pain worse. I couldn't even sleep at night. So finally, I got up with Dr. Hauser, and he told me about prolotherapy. And at this time, I was going to try anything. And within the first treatment, I was back out playing. And within 4 weeks, 2 treatments he did on me, I was playing my first tournament in over a year and a half.
Really?
Yes.
And now, did it hurt?
No.
It didn't hurt when they were...
No, it did. It was a little uncomfortable,
it was unpleasant.
like the doctor said.
Okay.
Yeah, but the pain, right, he's right. After the session, the prolotherapy session, I immediately saw results. Immediately. I saw strengthening of my wrist, and I saw pain relief, at least moderate pain relief.
Wow, is this you?
Yes, this is me.
Hey, you're great. Boy, when I play tennis, it's bionic ball time. You know, I hit the ball. The person who's playing tennis with me always gets a great workout. I don't. I just hit the ball and it goes right over the fence and over the house and everything else. But you're doing a lot better now.
Yes, and since then I've visited a few orthopedic surgeons about other injuries, and a few more injuries I had. They recommended surgery, and I went back to Dr. Hauser for prolotherapy, and those parts of my body are perfect now.
Wow.
No more pain. I don't have to take Tylenol, Advil, you know, no pain medication.
You're back to
pain-free.
Back to normal.
I'm better than I was when I was 14 years old.
This sounds like a miracle. Is it for everybody that's got chronic pain?
Indeed, like every therapy, is not for everybody, and depends on indeed where the pain is coming from. If the pain is coming from the ligaments and tendons, like in the lower back here.
Yeah, and you've got a nice little model here. Let's see if we can get that good. Okay.
We proceed with the injection, like let's say from the pain coming from sacroiliac joint, and the injection being deposited in small increments, the materials around the posterior sacroiliac ligaments here. This grows new tissue, make the sacroiliac joint stronger. And sacroiliac joint, as a matter of fact, quite often is a significant source of low back pain, and often confused with the disc problem or the spondylolisthesis in the athlete.
Okay.
If this is indeed the case, one may differentiate by the injection if the pain is coming from the sacroiliac joint or the facet joints or what we call the pars interarticularis.
Well, now, how many doctors are doing this right now in the United
Currently
States?
in the United States, I believe there is approximately 1,500 physicians are doing it. Majority of them are associated with the American Association of Orthopedic Medicine and being trained through the seminars and preceptorships.
Do you find that people, other physicians, are somewhat reluctant to accept prolotherapy?
Indeed, there is a little bit of a case. Nonetheless, currently we have introduced this as a elective in the osteopathic school here in Florida, where I am teaching. And some of the students coming to the office for the preceptorship, and hopefully by the time they will reach the practice, they will be full-fledged, capable of performing the procedure.
Well, you mentioned earlier that you use a solution that's got sugar in it. It's a sugar
Yes,
saturated liquid.
12.5% dextrose with 1% xylocaine usually is the beginning solution. Indeed, if the patient responds positively, we may go ahead and increase the solution up to 25%, or switch to a different irritant such as sodium moreuate, which is cod liver oil, or sometimes
Cod liver oil?
Yes, it's an
That's
extract
amazing.
of cod liver oil. It has been extensively used for intravenous sclerotherapy. However, not as concentrated. It's used in the peripheral tissue, such as ligament and tendons, to promote the healing of this tissue.
Now, before people that are watching this decide, well, hey, I've got some cod liver oil, I've got some water, and I've got some sugar, and I can go get a needle. This is not something that you would do at home.
Well, it's not something I'll do on the kitchen table.
Yeah, okay, all right.
And obviously, definitely, training of a physician is required, and the physician has to be quite familiar with the anatomy and the physiology of the tissue injected, as well as the feel of the needle. So it's not something you just right away go to a course and proceed in the office doing. Nonetheless, such peripheral ligaments and superficial ligaments like medial collateral ligament of the knee or lateral collateral ligament of the knee, one may try on the trial basis and see if it works.
A trained professional should be doing
Yes,
this.
of
You don't
course.
light yourself up at home and decide you're going to go get some
No.
sugar.
This book is the best thing to read.
Yeah, and
if you have
this
any
is a
questions.
very good book, actually.
This
I did
is
have
very
the time
easy
to read
to
it.
understand,
Yeah.
and it has everything that prolotherapy helps, whereas cured is in there, and it will talk about the success rates, and Dr. George Hackett, who started prolotherapy, or his type of prolotherapy, and talks, and Dr. Hauser wrote it, and it's a really good base, if you want to, of prolotherapy.
Yeah, I believe C. Everett Koop actually
Yes,
wrote the foreword
he
to
had
this
success
book.
with prolotherapy, and that's
So,
why he.
our former
Yes.
Surgeon General, which says an awful lot. Are there
Yes.
people who should not get this procedure?
Yes, people who frankly have a disc herniation will probably not benefit from the procedure. People who have rheumatoid arthritis usually do not respond well to this therapy. People who have gout do not respond well to this therapy and indeed have exacerbations. People who may have some other symptoms with the central nervous system should probably not try it. I personally found that it's not helpful in spastic conditions. So, of course, a general examination of the patient is required. Familiarity of the physician with the neurological signs is required. Familiarity with the physician with the applied and the regional anatomy also required.
Now, what about cost with something like this? How much does it cost? Because you'd mentioned that you don't just go in one time, right? You have to go in
very
several
inexpensive.
times. Is it?
It's fairly inexpensive. It's like all the trigger point injections. It goes under the same code, and majority of the insurance company reimburse it.
Really?
Under
Insurance
the same
companies
code.
do?
Yes.
Well, that's good to hear.
However,
because
they're
it's hard
not
sometimes.
consistent, and one
Yeah.
may have
So you need to check with your
inquire with your
insurance
insurance
before you-
carrier. Yes.
Okay, all right. Rob, this is very different, very interesting. I mean, certainly you're familiar with all the things that you heard Dr. Linetsky talk about, the trigger points, all these, the sacroiliac joint and all of this. Is this something that you, a conventional doctor in orthopedics, would be interested in pursuing?
Well, in a way, it makes sense in a lot of different ways. A typical thing that we treat with trying to stimulate growth again or stimulate a response is in Achilles tendonitis, okay? One of the last things we will do, in other words, after we've tried all the physical therapy and different modalities, one of the things we'll try to do is go in and take a portion of the tendon out, little pieces of the tendon out to stimulate a growth. This almost sounds like it does the same thing, and if you can do it non-surgically, well, certainly it's better than not. So obviously it's something talk into.
Well, and that's really the purpose of this whole segment, is to share with our viewers the fact that there are some new and emerging things coming out there in the world of chronic pain management, and we want you to know about them. And sometimes it's hard when you're out there as a patient in pain trying to figure out, you know, what is this a good thing, or is this guy going to paralyze me? You know, I mean, does he know what he's doing? Has he been trained properly? If you're out there in Nebraska and you're having pain and you've been to an orthopedist and you think that perhaps prolotherapy might be something that could help you, how do you find a prolotherapist?
I believe you have a 800 number provided by Dr. Hauser, but
Okay.
there's also the national organization called the American Association of Orthopedic Medicine. You can find them on the internet or call the 1-800
Right.
number directory.
Okay.
They will give
And
it
I'm
to
sure
you.
that's on our website too. And there it is. It's a miracle. If you'd like more information, the number to call is 1-800-RX-PROLO. And you can get some real clear information. The thing that is important is the point that you made, Dr. Linetsky, that this is a wonderful therapy for some cases, not for all cases. And I think that as one thing that patients should remember when they're out there looking for care, if someone tells you that one bullet works for everything, chances are you're looking at something that's probably not real. But when you have someone that tells you, in this case, it's very effective, and this may not, you know, it may not be so good in this case, then you're probably on the right track. And then it's a matter of finding the right doctor to take care of you. And Greg, you're doing well now, and
Yes,
everything is wonderful?
Excellent. I'm doing really well, and I owe my career to prolotherapy and to
All
Dr.
right.
Hauser, and that's why I'm here today.
Yeah.
And you know,
And ready to make more
Yes, absolutely.
championships and do very well.
Absolutely.
Well, I want to thank all of you for being here today and sharing all of your stories. This information is so critical. If you'd like more information on prolotherapy, you can call 1-800-RX-PROLO, or you can access our website at ahn.com to order a copy of the Prolo Your Pain Away. Thanks so much for watching. We'll see you next time.